So I'm Jennifer Sherwood. I am the policy manager at amfAR, the Foundation for AIDS Research, based in Washington, D.C. PEPFAR has been monumental in shaping the way that the HIV funding responses, the global response has taken place. I think what originally PEPFAR was launched as a crisis initiative. We were in crisis when PEPFAR came forward, and we had to move fast and mobilize resources into the community and at the country level. And I think now we're reaching a phase in the pandemic where PEPFAR is transitioning to really build the infrastructure that's going to last. And so it has been working towards this over the past many years, and will continue to do this by making initiatives like requiring money to go directly to organizations, community-led organizations, and moving the response to being more local, I think is in order to transition and be more sustainable going forward. So I think that's my vision for PEPFAR. I think that in the beginning, what needed to be a big influx of resources to combat the crisis has now moving to a phase where we're building. We're building the infrastructure that can last and allow countries to really take over their own responses. PEPFAR has done some really important work to adapt to the COVID pandemic. I think one of the examples that was a huge success that I would highlight is the uptick of multi-month dispensing of HIV medication. It's been a long time goal of PEPFAR's and national governments, and the COVID pandemic really showed a spotlight on where those gaps were and where we weren't getting people long enough prescriptions to medication. And so I think that's one positive light that's come out, and PEPFAR has adapted their programming in other ways too, but I think that COVID showed a light on where there were gaps in our healthcare system. And so I'm hoping that one silver lining of this is that PEPFAR can use those lessons moving forward to really adapt their programming to strengthen supply chains and be a stronger deliverer of services overall. The infrastructure that we've invested in through PEPFAR is there, and to pull back funding now would be really a loss of that investment. It would be a missed opportunity. Epidemiologically, we've brought the pandemic so far, and these steps that we're in now, which require reaching the hardest to reach populations, combating policy and social barriers, really fighting legal battles to really make sure that populations that need these resources are getting them. That's going to be the hard work. The investment that we've made thus far has been instrumental in building the infrastructure to combat HIV, and so the time is not now to give up on all of those investments. You know, we've done so much, and we're in a position to move the needle so much farther with the right influx of resources. And I think it's time to step up and do that.